Yeah, we actually just got done with the course today, and I'm a little bit whooped. So I'm glad you're here, Marcus. It's nice to see you. Yeah, each student actually got to place 12 implants. Both we had two of the doctors 12 implants each. The other doctors were about 8 implants. It depends on skill level. In the course we always say 3 to 5, but we want to place as many as possible. And so when they're here, they're taught the principles. And the way to learn implants is by getting in the mouth, doing it. We're not about, hey, here's a pig jaw, here's a mannequin, and there you go. The first few days of the course is just like major, intense practical training on the things you need to know to be able to just get in there and do it. We're not messing around on geeky theory stuff. If you want a geeky theory class, there's plenty of classes that go into the scientific details and blah, blah, blah. We're practitioners. What you need to know, we're going to give you. We're going to teach you how to place implants safely. You're going to be able to place about 70% of the implants getting out of this class. First few days, didactic, you are just getting drilled. And then the next 2 days is total surgery days. And the first surgery day is to prep you on extractions, grafting, the different types of grafting. You get exposure that same day to simple implant placements, fresh placements, easier cases. We're prepping those doctors on the first day for the second day. Second day, each doctor typically will get a big ass case. Excuse my language, but that's the way it is. So today was hell day for our guys, for our doctors. They are whooped. They've been here, but one of our students, she had 12 extractions, 6 implants to place immediately on a patient, delivering a denture.
That's crazy.
It's nuts. First time she did it in 2 hours, and she took the skills. This course was about personal one-on-one. This is a boutique class. It's 6 to 8. Come and have a blast. Get to know us. And be able to get back into your practice and immediately place. If these guys go back to the practice, since they're basically graduates of the SI first course and the second surgical course, they can call us. One of their professors, each faculty member will be assigning their students. They can just give us a call and say, hey, listen, I need to fly in for a day. I need another placement. They can fly in, we'll load another 10 on them. Once they're around 20 implants as a doctor, you're getting the feel. You're getting the feel and you're feeling comfortable. Even at 10, you should see these doctors. They came in, and one of my doctors for immediate placement, she placed 3 implants in about 20 minutes.
That's crazy.
She's 2 years out of school. Safely. We did post-op cone beams on them, pre-op. We have sponsored by Acteon cone beam, and they teach a cone beam class how to do interpretations. Just a lot of cool stuff. Dentistry is a lifestyle, man. There's so many circling dentists, and you don't have to, man. And actually, once you get the implant bug, man, it's a bug. You are addicted, and it's a lot of fun that can actually change your practice dynamic. So if you like surgery, you like extracting teeth, you want something that gives you a change, and you want to take a C course that you just get hammered like a residency program. What do you think that they had if you apply to oral facial maxillary surgery, or you apply for prosthodontics? You got a group of 6 residents for 3 years. So what do you think it's going to be if you go to an implant course and there's 40 students? Yeah, so we've designed it more on a residency type of environment where you get that hardcore didactic. These guys on the first day, they're going back and studying, and we don't have to tell them. They're on it. So, hopefully you got to interview some of our students.
Yes, we did.
They, don't know what their reviews are. They're probably seeing cross-eyed. But I'll tell you, it was very a privilege to actually be a part of their education. And now they're ready if they want to go and learn advanced training and things like that in other different institutes. We're about the guy who has no experience, no training. Come over here, you will get out, and you'll be satisfied.